Good evening. Welcome to the 6th virtual town hall on the COVID-19 pandemic. I'm Xavier Richardson, Senior Vice President and Chief Development Officer of Mary Washington Healthcare. For over 120 years, Mary Washington Healthcare has been the premier healthcare provider in our region. We thank you for your continued support of our organization through your many donations during the past several months. If you would like to make a donation, you may go online at donate.mwhc.com. Again, donate.mwhc.com. As the only nonprofit healthcare system in our community, we consider you to be our major stakeholders. Therefore, we believe that it's imperative that we keep you apprised constantly of the newest developments of this pandemic in our community. This evening, our panel of experts will provide you with the latest update on COVID-19 and will provide you with an opportunity to be engaged by submitting online questions throughout the program. At this time, Emily Thurston will introduce our panelists.
Thank you, Xavier. Tonight we have with us Dr. Mike McDermott, President and CEO, Dr. Christopher Newman, Chief Medical Officer and Chief Operating Officer, and Eileen Doman, Chief Nursing Officer. And we'll start tonight's program with Dr. McDermott.
Good evening, everybody, and thanks for taking some time out of your evening again to join us here for our Mary Washington Healthcare Town Hall with the community to talk about what's going on with COVID-19 and all the issues in our community. I always like to start by sharing a little data about what we're seeing now in our Mary Washington Healthcare facility. So if we can bring up the data dashboard. We are currently caring for 23 patients who have tested positive for COVID-19 and require hospitalized care in our facilities. We have 15 patients in the hospital who are patients under investigation who are still waiting to get test results back to understand whether or not they are positive for COVID-19 or not. We have discharged 137 patients who have been hospitalized in our hospitals back home, and they've recovered from COVID-19. We have had 17 deaths of patients who have had COVID-19 who have succumbed to the disease. So far, in all of our testing that we have performed, we have had 571 individuals who have tested positive for COVID-19. One of the more recent things happening in our community is, as many of you have probably seen in the newspaper, there is a relatively large outbreak at one of the local long-term care facilities, and we have seen some impact from that outbreak in that very high-risk population in that long-term care facility here at Mary Washington Healthcare. I also wanted to bring you up to speed. The last time we spoke, we talked about starting some surveillance testing or antibody testing. Remember, that's the test we can administer not to tell you whether you currently have COVID-19, but whether you might have had it at some point in the past and your body has built up antibodies to that virus in the past. And so we have the capability to perform that antibody test. It's a very high quality antibody test. And we started rolling that out amongst our associates here at Mary Washington Healthcare. We started with what we consider to be our highest risk associates, those that are in our emergency departments, our intensive care units, and on those units that are specifically caring for COVID-19 patients. And then we've rolled it out a little bit broader throughout our organization. So far, we have tested just about 900 of our associates with that antibody test. And a little surprisingly to me, only 16 have tested positive for the antibodies to COVID-19. And of those 16, when they filled out the questionnaire beforehand, many of them, most of them had some type of symptoms over the past couple of months. So they weren't even completely asymptomatic. So I think what this shows you is probably the prevalence of asymptomatic COVID-19 disease in our Fredericksburg community is very, very low, because this is a population I think many would consider to be at relatively high risk, and we're seeing a very low prevalence of those antibodies even in this population. So there's probably a very, very low prevalence of asymptomatic COVID-19 here in our community. One other thing I just wanted to address is, these are very, very challenging times. Not only are we in the midst of fighting a a global pandemic with what is occurring with COVID-19. But I know many of us have also witnessed the murder of George Floyd at the hands of those sworn to protect. And that has shined a light again on the systemic racism, I think, that is just built into so many of our society's institutions. It's built into our education system, it's built into our justice system, it's built into our employment systems. And I think the uproar and uprisings you've seen over the past couple of weeks is everybody just rising up and saying, you know, enough is enough with that, and we need to fix that. And Mary Washington Healthcare is committed to be part of that solution. And so yesterday, I'm proud to say that we organized a White Coats for Black Lives event here at our Mary Washington Healthcare facilities, and in our support of the Black Lives Matter movement. And so many of our associates gathered to take their oath in support of the Black Lives Matter movement, and so proud of our institution. And I'll just say, here at Mary Washington Healthcare, we will not tolerate discrimination or harassment in any way. There's no room for hate here. There's no space for racism. We are committed to equality and equity at Mary Washington Healthcare. And so proud of all of our associates and happy to have spent that time in that great event yesterday.
Great. Thank you so much, Mike. We are going to just dive right into some questions that we're getting from folks in our community. We are getting a lot of questions regarding antibody testing. So Dr. McDermott or Dr. Newman, I wonder if you could talk about how members of our community who want an antibody test might be able to get one.
Yeah. Here at Mary Washington, we are now first testing our associates. So as Mike had earlier said, we started with our high-risk units, our emergency department physicians and staff and nurses, ICU, those that have been caring for COVID, and now we're beginning to roll that out for all of our associates who have clinical positions here in our healthcare system. Once that rolls out, we will begin offering it to the community, mostly with, we'll start probably with first responders and other high-risk community people, and then we will probably open it up more broadly to the public. If somebody is very curious or specifically wants to know, they can see their primary care doc and get a antibody test. But again, we have to caution what the results mean. This is not a test, again, as Mike had said, to see if you have COVID. It's not a test to clear you for returning to work. This is a test to see if you've had some exposure during this pandemic to COVID to the point where you've developed antibodies at some point. So if you believe you've had it, particularly if you're interested in being a donor for convalescent serum, you can get the antibody test.
Chris, can you differentiate, because we talk a lot about asymptomatic, symptomatic, and then we talk about pre-symptomatic, and I think that's confusing for lots of people because we've even seen it in our own environment. So maybe explain the difference between the two.
There's been a lot of discussion since the beginning about asymptomatic carriers of this disease, meaning people who have the infection but have no symptoms whatsoever, and to what degree they may be spreading it to others unknowingly. Evidence is still out on that, but it appears that is a very small portion of patients who have the virus, and it's probably been overstated in most populations. And it's still unclear how contagious those folks may be. But the pre-symptomatic is the concern. So once you're exposed to the virus and you begin to get infected, it takes 5 to 7 to sometimes as long as 14 days before you have symptoms. But in those few days before those symptoms occur, you begin really developing a high viral load, replicating that virus and shedding virus. And you may be very contagious the few days prior to having symptoms. And when we make a lot of the recommendations about masks, or masking those in the facility, it's those individuals we're most concerned about who may have been exposed, may not know it. You know, the symptoms may be 1, 2, 3 days off, but they could be shedding and spreading to others. So it's really the pre-symptomatic that I think is the biggest concern. Yeah.
Mm-hmm. Thank you. Dr. Newman, we do have people wondering how accurate the antibody tests are. Is that something that you could speak to?
Yeah. So these tests have not been around a long time. They do not have formal FDA approval because that takes time to get that with any test, and COVID's only been with us a matter of months. So they've had emergency use authorization, and they've studied it on smaller amounts of patients than they normally would with a test similar to that. That being said, the blood test, it requires a blood draw, not a finger stick, but a formal blood draw. If the test is ordered 8 to 14 days following the symptoms of the disease, the sensitivity and specificity begin to approach 100%, meaning if you've had exposure, it should be positive. If it's a positive, it's positive. So there could still be false negatives, but the tests are fairly accurate at this point. But as we begin to test thousands and thousands of patients, we'll begin to learn more about the accuracy of these tests.
Thank you, Dr. Newman. We have a lot of folks in our community, very excited about phase 2 reopening in the Commonwealth. People have been shut into their homes and want to get outside and maybe socialize and go back to their favorite bars or restaurants. There's definitely a temptation to return back to normal. So how would you guide our audience listening tonight into engaging safely in phase 2 reopening?
Well, it's not normal.
It's not normal, yeah. And I think the best way to think about it is the virus is indifferent to what it is we want and desire to do, right? The virus is the one that dictates the timeline here, and it dictates what we do. And I do think as we learn more about it, we understand those activities we can do that are safer than others, right? There are some things that we've learned. The idea of wearing masks, I think now it's very well established that in those places where people are wearing masks everywhere, there's less transmission that occurs, a lot of times below the ability for the virus to even replicate and proceed. Outdoor activities are looking to be significantly safer than those activities where you spend a lot of time indoors with the same group of people and somebody might have the virus. And so I think we can lean on that data that we are learning, those facts that we are learning as we move forward. But you need to pay attention to the behaviors that we know improve safety. Social distancing, maintaining distance from others, wearing a mask, right? There are lots of things that we can do. Limit your time exposures to others. There are things that we can all do to improve the safety for ourselves and for those around us.
Mike, you talk a lot about dose and time, and I think that's pretty simple. I think that makes it easy for people to understand. Dose meaning that if you're close to someone who has the virus, and again, as Chris said, they may not be having symptoms yet, so they don't know. If you're very close to that person and that person coughs or sneezes on you, that's an intensive dose. You could get COVID from that. But if you've got a mask on, they have a mask on, then that's protected. You're outside, so there's more air that's circulating. So dose is the intensity of being close together. The air is close together, not a lot of circulation. The time is how long are you doing that for? And so when those two things come together and you think of the situations you're in, that's what you want to avoid. That's where your greatest risk is of the virus being transmitted and you catching it. So I really do think that time and dose makes good sense that people can relate to.
Yeah, so as we enter these new phases of reopening, I just encourage everybody to please stay safe.
Yes.
Stay safe and keep these things in your mind. Keep following those safe tactics.
Yeah, and I hear a lot of people talking about, well, we're not going to wear masks and we're just going to go out and do things the way we normally did because that's the way we get herd immunity. And there is no herd immunity here. We're not even close. The nearly 1,000 people that we tested here at the hospital that would be the highest risk, we had less than 2% have antibodies.
And remember, many of the viruses that we have dealt with as a human species throughout our existence, measles, chickenpox, we never achieved herd immunity with those viruses until we had vaccines.
Exactly.
And you have vaccine-mediated herd immunity. So it's very unlikely as a society, by being around one another, we're going to achieve any sense of herd immunity to the coronavirus, this novel coronavirus, without the emergence of a vaccine that assists us in getting there. So,
yeah, it's a very dangerous, I think, outlook when I hear that.
Yep.
Thank you. Dr. McDermott, Dr. Newman, some folks are wondering about the development of a vaccine. Do you know of any advancements?
You can go ahead.
There are a lot of different companies and working on this right now, faster than has ever occurred in human history after a new pathogen like this. I've just recently heard Anthony Fauci and some others talk that are optimistic at the very early phases of these vaccine trials. I think optimistically, if everything goes perfectly for one of these vaccines, I'm hearing probably next summer is when they may be available readily for folks. I think those that have been hopeful for a fall vaccine, I think that's probably highly unlikely. So I think this is going to be with us for a while, something we're going to have to deal with for a while. And I think best case scenario would be sometime next summer that we just begin vaccinating. It's just the best knowledge we have at this point.
Thank you, Dr. Newman. We have some folks in our community still hesitant to come out and receive medical care, whether that's routine exams or perhaps putting off some more serious conditions that really should be looked at. Can you speak to some of the measures that we're taking to make sure that our facilities are safe for people to receive care?
Yeah, we are seeing more and more patients coming in to get the care that they need, and that's good news. But we do know there are still many patients out there that require care to improve their health outcome, and they're delaying that care. And I just encourage everybody out there to talk to your loved ones, talk to your friends, and encourage them. If they have a medical health care need, please come have that need met. Our facilities are extraordinarily safe, right? Our facilities, we've talked about this before, our facilities aren't like other typical facilities out there. There are things we can do with airflow and pressure and filtration that are just unique to the way hospitals are built. And so I feel our hospital is one of the safest places where you can actually be, and where you're going to be in an environment where everybody around you is taking steps to ensure your safety and their safety. And so please, if you have a healthcare need, you should come have that healthcare need addressed so you can improve your health outcome. Very important. We are seeing stories here locally, regionally, and nationally of patients who have delayed healthcare and have had very bad outcomes as a result of those delays. And those delays are just unnecessary. So please, if you have a healthcare need, please have it addressed.
And beyond the safety, it's difficult facing a healthcare challenge alone, whether that's a hospitalization, a surgery. So we've worked hard to begin to open up visitation in a very safe manner. And other than our COVID patients and those units, we are allowing a visitor for each patient in the hospital or the emergency department, and have been for several weeks now. We are now making plans by next week to open up visitors or visitation in a very safe manner for those having outpatient procedures such as endoscopy or an outpatient surgery, a cardiac procedure, and an interventional radiology procedure, to continue to make it patients feel very comfortable having a loved one or someone with them as they face their healthcare challenge.
But if you come to our facilities, we're going to do everything we can to keep you safe and to keep our associates safe. So when you come through our front door, you'll be screened. We'll check your temperature. We'll make sure that you're wearing a mask. Everyone in the buildings will be in our buildings are wearing masks. And we will limit where you can be in the building. And as Chris said, if you're a visitor, then you'll be the visitor for your loved one wherever they may be in the hospital. But we're really very focused on keeping you safe. I was thinking about it before when we talked about testing our emergency department staff, that they're at high risk. Even in our emergency rooms, we are segregating. If somebody comes in and has symptoms that we think could possibly be COVID, they're in a separate area of the emergency department. So they're immediately, as soon as they arrive, the two patient populations are separated because we know that that's your concern. It's our concern too. So we pay very close attention in our physicians' offices, making sure that we don't have people sitting in waiting rooms, that we have people maybe waiting in their car and then they get a phone call that it's time to come in for their appointment to see their provider, or do telehealth visits so we can still provide care. So we're doing everything that we can to keep you safe, and we're doing a good job. We are safe places, and we're very focused on that. We want you to feel comfortable to get your care because it's very important. Your health needs to be your first priority.
Thank you, Eileen. You mentioned visitors in our facilities, and a lot of people who need procedures have been concerned about whether or not they can have visitors with them in the hospital. Can you speak to some of our visitation policies?
Well, sure. As Chris just mentioned, for patients that come to our emergency department, we are encouraging one visitor to be with them, so that can come back into the emergency department room with them. For those patients that get admitted to the hospital, so they're going to be staying in the hospital, then we've also encouraged that one visitor be designated, be somebody that can come to visit. We're limiting visiting hours from 12 noon to 8 p.m. For that visitor to come. Again, when visitors come in, they'll be screened at the front door. We'll make sure that they're wearing a mask. And as Chris just mentioned, you know, we know that it's hard to come to the hospital when you can't have your loved ones with you. It's lonely. It's scary. People don't come to the hospital usually feeling well. And so to not have a loved one, somebody with you that can help hear what you're hearing from your doctors, or understand your discharge instructions, or understand the medications that you're on, it's important to have somebody with you. So even in our outpatient settings, starting next week, we're working to make sure that people can have that one visitor with them, because we know that that's important to help you feel comfortable in coming to get your health care and not feeling alone and isolated when you're with us.
Thank you, Eileen. You mentioned how we prioritize the safety of our associates and our patients, and some of the folks in our community are curious about workplace exposures that we may have had during the pandemic. Can our panel speak to that?
Yeah. So we've had a period of almost 8 weeks where we had no nurses or associates test positive or have a work-related exposure. Unfortunately, just sort of underscoring how dangerous this virus can be, or how infectious it can be, we had 2 of our emergency department physicians contract the virus about a week and a half ago, and one has recovered and one is recovering. But it is, we can't let down our guard at this point. It's something that we're trying to reinforce with all of our associates and medical staff here. It's easy after something goes along for months and months on end to just get used to it, drop down your guard, forget to wash your hands after you saw a patient, not wear your mask appropriately. So we really have to be hyper vigilant to protect our associates and staff, and that's really been one of our biggest priorities since the beginning of all this.
Thank you, Dr. Newman. Someone in our community has recognized that our health system is a valuable resource for our community, and they're wondering about the financial health of our organization.
Yeah, so the COVID-19 pandemic has affected every health system in our whole country in a negative way. Our health systems back in the middle of March stopped all of the scheduled procedures that we typically do every single day here within our facilities in order to build capacity, because we had so much uncertainty about how this virus was going to impact our state and our local communities. And so that had a financial cost to it, and that cost is borne by our healthcare system. Now, it was the right thing to do. Nobody's going to say that was not the right thing to do. It's absolutely the right thing to do. But it did have a significant financial negative impact to the healthcare industry and Mary Washington Healthcare as well. Now, we're a successful health system and we can weather that, but we do need to take steps in order to help improve our financial outlook as we move forward. And so we're doing that as a health system. We're strong and we're going to make it through the COVID-19 pandemic.
Yeah. Okay. Thank you, Dr. McDermott. Going back to the conversation we were having about masks, we know that there are some folks who have difficulty breathing and maybe wearing a mask is not comfortable for them. What suggestions might you give to someone who has difficulty breathing while wearing a mask?
I think I understand masks are very uncomfortable. They're uncomfortable when you wear glasses. They're uncomfortable when you're in a hot situation or the heat. Wearing them for long periods of time can be uncomfortable, but most standard masks are breathable to the point where they should not be interfering with breathing. In healthcare, long before COVID, we've had healthcare workers and physicians and nurses in very long operations have worn masks for 12 or more hours at a time without difficulty. It certainly is uncomfortable. It's certainly not fun. It's certainly not something we all want to do, but it is a safe thing to do. There's no evidence that wearing a mask is going to hurt your breathing or be unsafe as long as you're wearing an appropriate mask.
I think it's just getting used to it. It's an uncomfortable feeling when you first wear it, but once you get used to it, you sort of forget that it's even there, but it is an adjustment.
And there are lots of styles and varieties of masks too, and they all fit differently. And I would encourage everybody to find a size and a fit and a shape that matches your face and is most comfortable. Maybe has a little bit more space, maybe between your skin and the mask. Even wearing face coverings like bandanas and other sort of things and scarves can create the same sort of protection of preventing droplet spread, but might be more comfortable for some people to wear. And so I encourage everybody to find some mask solution that matches comfort and also prevents that safety of decreasing the droplet transmission that can occur.
But when you're wearing a mask, make sure it covers your nose and your mouth. I've been out somewhere where I see people covering their mouth and their nose is wide open. Remember, the way that this virus is transmitted is through droplets that you inhale. You inhale through your nose and through your mouth. So if you're going to wear the mask and wear it under your chin or wear it over half of your mouth, don't bother because you're not going to get the benefit of any protection of yourself. It really is important that you cover your mouth and your nose.
We did a demonstration even on we do town halls here internally with our associates and managers, just again reinforcing the proper way to wear a mask. And you do need to cover both of the respiratory organs on your face, your nose and your mouth. They both can shed droplets. They both can be a pathway for entry of the virus as well. So masks need to cover your nose and your mouth is the appropriate way to wear a mask.
Great.
Can't leave your nose out. You see a lot of that out there.
Yes.
And you see some of this out there too. That's not going to be effective, right? It has to cover it all.
Thank you for that demonstration. We've had a couple people in the community wonder if we anticipate a second wave of this virus hitting us later in the year and how Mary Washington Healthcare is preparing for that potential event.
There's a lot of uncertainty, and I don't think anybody knows for certainty what we're going to see as we head into the fall. I think a lot of the prediction is done from experience with other viruses and how the patterns that we tend to see with those viruses, and so we lean on those, and there are many people suspecting that we might see a secondary surge maybe in the fall time frame, maybe through the winter. It's hard to know, and so I don't think there's a lot of certainty about what it is exactly that we're going to see, and so we need to prepare in the face of that uncertainty, and I think that's what we're doing here at Mary Washington Healthcare. We are preparing for a potential fall surge, late summer surge, winter surge. We need to be prepared at all times for a surge because we know we've seen the impact of what this virus can do in areas like New York City, in countries like Italy, where it can absolutely overwhelm community and healthcare systems. And so that's why we need to continue to monitor and follow data, testing data. We need to improve our testing turnaround times, and that is occurring as we continue to move forward, and we need to be prepared to make sure that we can handle any potential surge should it come. I don't think anybody knows for certain whether that will come or not. We need to be prepared for it.
Thank you. Eileen, we have a question coming in that I think is uniquely suited for you. Our community is wondering when we might expect to welcome our volunteers back into the hospital.
There they are again. As quickly as we can safely get you back in the building, and we are working on that, trying to think about what are the roles that our volunteers fill and how can we bring them back in the safest way. And I think I've given this example before, but a huge role that our volunteers play, particularly at Mary Washington Hospital, is our discharge volunteers, meaning that when a patient is ready to leave the hospital, they call and a volunteer goes up and brings the patient down to their family member's car. And that's a huge help to the nurses and the CNAs that are up on the floors because the volunteers take on that role. The challenge with the way we used to do that was that those volunteers are all waiting in an office to get the call to come up to discharge a patient. Well, that's a group of people in a small space. That won't work. So trying to figure out a different way that we could have them be waiting but not be waiting in that small space. You know, things like our gift shop, things like our information desk. I'll tell you, this morning I was with some of our nurses on one of our COVID cohort units, and what they were missing most was besides the discharge volunteers, were the volunteers that come up delivering the newspaper and delivering flowers, because they just enjoyed having people come up. The volunteers were always very pleasant, and they missed having that. So we want to make sure that we can bring you back safely. The buildings are not the same without you, but we have to do it safely, and that means we have to think about every role that you fill and how we can do that in a safe way. So we are trying to come up with those solutions as quickly as we can. The other thing that we have to think about as we bring more people back into our building, whether it's our volunteers or students, is our PPE. Because we are continually planning for what about if there was a surge. And so we're looking every single day at how much PPE are we using every day? How do we project that out for how long will it last if we use it at this rate? If we increase its use by bringing back volunteers, what would that impact be? So there are lots of considerations, but we are working through all those plans. So I hope in the next several weeks we'll be able to share more about how we might be able to reintroduce some of our volunteers into our facilities.
Just speaking about the PPE, the personal protective equipment that we all use in healthcare to keep everybody safe, and give an update on that, because I think we spoke about that on previous town halls, but we are seeing some of that deliveries of masks and gowns and things that we need, but it's not the supply chain that we had where you know, you could really trust it and count on it. You know, in the you know, back pre-COVID, if we placed an order for something at 4 o'clock in the afternoon, it would be here the next morning, and in the amount that we asked for, and it would show up on time where we asked for it, and that has still broken down. And so things are coming in kind of spurts. We are getting some resupplies of the materials we need, but we still need to be judicious with our use of that. And we're even looking at ways to step back and use things like cloth gowns that can be laundered. We used to do that in the past. Everybody moved away because it was so easy to get disposable gowns that were inexpensive. But now, when you can't get that stuff easily, you want to go back to the cloth gowns, which were great to use, very comfortable, and they provide great protection.
Yes.
And launder them, and then you always have that gown available. You can count on your own internal processes, and you're not dependent on kind of a national supply chain to resupply you with those things. So we're looking at lots of different tactics to help us be in a good position in the long term.
Thank you. We've had some questions regarding recent news headlines about COVID-19, and our community would love to hear your thoughts on those. One is a headline about people with certain blood types being more or less likely to contract COVID-19. Can you comment on that?
Yeah, in science, we observe and we look for patterns and we look for trends in data. That's how basic scientific data comes about in studies. So there are a lot of folks right now, as this is going around, looking for these trends. They're looking for these patterns in the data that we're all seeing. That does not make it so. For every 9 of those that will be false, for maybe 1 that turns out to be true. The uncertainty that Mike talked about is very difficult. We want to latch on to these as being truths. We see something on the news and we hope it's true. But these patterns or these trends that we see is just the starting point to form a hypothesis and start a formal, larger study as we begin to learn more about this virus. So when I see something about a certain blood type making you, that you won't get COVID if you have a certain blood type, that concerns me that somebody may take that to heart have that blood type and engage in risky behavior and put themselves at risk, because that's not certain. You know, we will learn more about this as it goes on. We'll follow these trends and we'll get more data, but at this point we do have to be a little bit more comfortable with uncertainty. Even some of the medications that we're using, some of the treatment protocols that we're using in the hospital have not been formally studied. They're not formally FDA approved. We're using them within study protocols, and we're trying to learn more about these. And some have shown some promise, and some have not, that we initially thought were going to be very promising. So you have to take everything you're seeing in the press with a grain of salt. There's some truth, there may be some trend to it, but it's not fact.
Yeah, we have no cure for COVID-19 currently, right? You know, I know in the news you might see remdesivir or this drug or that drug, but none of those drugs are a cure, and they're not a magic bullet. And there are patients that receive those medications that do not have good outcomes, and so we have no cure. Like Chris said, a lot of the data coming out with the blood types, and I don't even want to say the blood types and what they're serving. Yeah. They're small initial observations in series of data that need to be validated over the long term, and many of those are just small differential tendencies. Certainly, I think the best way to say it is there are patients with every single type of blood type that have gotten COVID-19 and have had very severe disease with it, and so there's no single protective thing that we're aware of currently.
What's been so confounding about COVID and so difficult is that we know that folks over the age of 70 and 80 can have very serious outcomes from contracting COVID. But others, we see somebody who gets mild to very minimal symptoms, a 20-year-old and another 20-year-old who may die. And it's really difficult to know, why is somebody getting such a mild disease, or so many in a certain group have a mild disease and yet another be hospitalized and have a catastrophic outcome. So the range of outcomes with this particular virus are really astonishing, actually.
Well, when you talk about two 20-year-olds, so one has mild symptoms, one serious symptoms, and may die. Isn't that part of what we need to study, right?
Yes,
because this is all so new. We don't know why that is. Yes. That's why this study. So somebody can have an idea of what they think it might be, but that needs to be studied. That needs to be researched. Exactly. And even when we talk about remdesivir or convalescent serum, those are in research protocols. We're part of research studies to try to get to the science of what could be effective treatments. And it's because the virus is new. We don't know.
Yeah, one of our human biases, we don't like uncertainty. Humans don't like uncertainty. They like things to be certain. And so I can understand the tendency for people to read these things in the news and to latch on to them. Like it's now we have a cure, or we know what makes it better, or we know what protects me, because that would get rid of uncertainty for you. I think we all have to recognize that bias and recognize the uncertainty we still have surrounding COVID-19 and this novel coronavirus and how much we don't know. And I would just caution everybody, don't latch on to anything there too early. It's just a little early for that.
Thank you. Another headline that we've seen recently indicates that people who are asymptomatic with COVID-19 are not able to transmit the virus to other people. What are your thoughts on that?
Well, we talked a little bit about that earlier, and this came out of that World Health Organization where one of the officials was answering a question. It got taken a little out of context because it was a very specific question, but it's that trying to differentiate between the term asymptomatic and pre-symptomatic, right? And so there can be a point in time where I don't have symptoms. I'm infected with COVID-19. I don't have symptoms, but I'm about to have symptoms tomorrow, right? And so that day today, when I don't have them, I am pre-symptomatic. I'm about to get my cough and fever tomorrow. On this day that I'm pre-symptomatic, many people might also say I'm asymptomatic. I don't show any symptoms, right? But certainly pre-symptomatic individuals can spread the virus and infect others. There are many cases and epidemiologic studies that trace people who were pre-symptomatic that have spread it in certain environments. And so I think the long story short is people who are not showing symptoms can spread the virus. That's what everybody needs to know. People who are not showing symptoms and are infected can spread the virus. That is well known.
Yes.
They are pre-symptomatic.
Okay. Thank you for that clarification. We have some members of our community wondering if medications that they might be taking, such as Flonase, could impact COVID-19 test that they're taking, the swab test. Is that a concern?
I'm unaware of that as being a concern. The nasal swab test we do is a PCR test that amplifies RNA that is in the virus. So I would not suspect that Flonase should interfere with that. I have not heard that specifically, but that should not be the case, and I'm not aware of that. Yeah.
Great, thank you. Well, we have wrapped our questions, and so it's time for our panel to share some closing thoughts with our community. Eileen, would you like to start us out?
Sure, I'd be happy to. I've been with Mary Washington Healthcare for over 16 years, and I've always been very proud to be here. I'm proud to be a Mary Washington Healthcare nurse. But I don't think I've ever been prouder since yesterday afternoon when we did white coats for Black Lives. And then this morning when I spent a good hour and a half with nurses on one of our COVID units and heard their stories about why it was important to them to do a good job in taking care of their patients. So I'm proud to be a Mary Washington Healthcare nurse, and I'm proud to be part of this organization. And I want you to know that that coming to Mary Washington Healthcare, you will be safe. Your safety is our priority, and we want you to get the health care that you need.
Thank you, Eileen. Dr. Newman?
Yeah, I would just say as society begins opening up further, we're in phase 2, there are going to be considerations of going to phase 3. So much uncertainty. Will they open schools? Will they do this? Will they do that? We all are stir crazy. We've all been sheltering in place, working from home, and want to get back to life as it was. But as we do that, and I know we need to open up the economy and people need to get back to some life, but it is going to be different and we need to be safe. So much uncertainty around this virus and what's going to happen with it, but simple things you can do is wear a mask when you go out, socially distance. Events outside are a little bit safer than inside small spaces. And if you are in an inside smaller space, limit the amount of time because the longer you're in a small space with somebody who potentially has COVID, the higher the chances that you can contract it. So understand that we need to get out of our houses and get back going, but please be safe.
Thank you, Dr. Newman. Dr. McDermott?
I just, Mary Washington Healthcare has been here in our greater Fredericksburg community for over 100 years, making sure our community has state-of-the-art healthcare. And this medical center that we're in now here at Mary Washington Hospital and our hospital up at Stafford Hospital and the 40 other facilities we have here in this Fredericksburg region are state-of-the-art facilities ready to care for your healthcare needs. And I'm proud to be a part of Mary Washington Healthcare. We're a not-for-profit healthcare system. I want to talk a little bit about just what that means. It doesn't mean we're not successful. It doesn't mean that we don't need to make money, but it does mean that every bit of our success, every bit of the money that we have, it isn't pledged to individuals or people, it's pledged to our community, right? It is pledged to our community and it's overseen by a board of trustees to make sure all of that success gets folded into better health care for the Fredericksburg community. And so I'm proud to be a part of Mary Washington Healthcare. I am so inspired by everything our team does every day, by everything our team here at Mary Washington Healthcare has done through this COVID-19 pandemic and everything that we're going to do heading into the future. And so I just want to again thank everybody for taking the time out of your evening to tune into these town halls, to stay up to speed with the news of what's occurring with COVID-19 and what we're seeing here in Fredericksburg. Thank you for taking the time to do that.
Thank you, Dr. McDermott. On behalf of Mary Washington Healthcare, thanks to our panelists for providing your expertise this evening. We also appreciate you joining us to learn about COVID-19 in our community and sending in your questions. For the latest local COVID-19 information, stay tuned to the Mary Washington Healthcare Facebook page and visit us online at mwhc.com. Good night.